More now than ever, there's a mental health crisis, and there's so much need for mental health, specifically with kids.
Butler Hospital, we work with a lot of severe and persistent mental illness, lots of psychosis, diagnoses that you don't necessarily see in other settings, like schizophrenia, bipolar with psychotic features, and it's just an amazing learning environment. The physicians are willing to educate all students across the different disciplines that are here.
My managers have always been amazing at wanting you to grow and giving you the opportunity to figure out exactly where your niche is. Even now in my position, I have my independent license. My supervisor's like, hey, why don't you go and try this training? Why don't you do this training? Explore your horizons a little bit more. And we're just so supported.
One of the benefits of my current role is that I supervise a partial hospital program, an intensive outpatient program, and outpatient therapy. So I get to see patients sometimes up to 2 years into their journey of sobriety, and it's really neat to watch. I've been here 17 years. When I was in grad school, I worked as a mental health worker. There were 9 of us that graduated the year I graduated, and many of them are still in the units as nurses. And it's really neat to work alongside people that have worked here for up to 20 years.
I am the Center for Autism and Developmental Disabilities residential manager. My favorite part is the kids. That's what's kept me here all of these years. I never thought I would enjoy a job as much as I have, and 25 years has gone by in the blink of an eye.
When we go to school, a lot of times you have a one-track mind, like I'm gonna get my degree and I'm gonna go into therapy. But there's so many other options out there for you. There's emergency care, there is hospice care. I challenge anybody not to just do the typical social worker path, look somewhere else. There's so much you can do with social work or with any sort of counseling degree that I don't think a lot of people know about.
Entering this career, you can really expect to have a rewarding career, that you really can connect with a lot of different people.
The best part of being a social service clinician is just seeing the success stories that we have on a daily basis. You see somebody come in that's very psychotic and can't function. We're able, with medications and therapy, get them to a point where they feel like they're returning to their baseline functioning. And I think that's just amazing to see.